I will thank you very much, the IFMBE and all colleagues for joining this session today. I would like to share my screen now. So just bear with me 1 second. Thank you. Can you see it? Tom, is this visible for everybody?
It is, thank you.
Thank you very much. Okay, so pulse oximeters. I just wanted to make a very important statement. Pulse oximeters are a critical medical device. They're a priority medical device. They're an essential medical device. And in the case of COVID, oxygen cannot be delivered if you don't have a pulse oximeter around to be monitor your patient. It doesn't matter that you use invasive, non-invasive ventilation, pulse oximeters need to be there near to the patient. So this is a very important statement for everything concerning treatment and clinical management of a COVID patient. So pulse oximeters are in the WHO priority medical devices list for COVID. This was published about a month ago on the 5th of April. And as you can see, the very first lines are specifically on monitoring, and then you have all the options for pulse oximeter, either portable, finger tip, or tabletop. And those are needed even from first level of care, from healthcare centers, district hospitals, general hospitals, and of course, intensive care units. People will think, why in first level? Well, because that is a very good diagnostics if a patient is having hypoxia. So it could be easily and fastly referred to a hospital. The priority medical devices has been published and it is available for everybody. We keep updating these versions, but it is important that we say, and we state here, that we recommend to involve biomedical engineers in the selection, verification of the equipment and ensure training of the health workforce. So this is very important. And we also want to request here that extended warranty is given, that all accessories and consumables are needed for all these products. So in the list for COVID-19, here are other devices that we have that have to accompany the pulse oximeter. We have been talking about some of them in the previous versions and the previous sessions, and we will be talking about ventilators in the next week. The documents that we have for the technical specifications for oxygen pulse oximeters are coming from WHO publications. This one specifically was from 2019 and was done with UNICEF. But all the specifications that are appropriate to COVID, you can find them in the WHO website on COVID. This one is the one that was used as a basic to all the presentation that I will give today, and to draft the specifications that are published in the website specifically for COVID. You can all download it. It is in this website. Next. As I was referring to in the last sessions, we have oxygen systems that we require the oxygen source, the oxygen distribution, the regulation and conditioning. We have been talking about blenders, CPAPs. We have been talking about oxygen sources. We need to have the delivery, but this part is absolutely indispensable, the pulse oximeter and the multi-parameter monitor. And where do they go? Well, they go all the way from primary level, secondary level, tertiary level. Anywhere where oxygen is distributed, we really would like to have a pulse oximeter. So there are various types here in this book, and we want to acknowledge all the work that was done along with UNICEF and many other experts to publish this book, is that you have the fingertip, the portable handheld, and then the tabletop. And for each of them, basically they measure pulse rate and saturation of oxygen saturation. We have discussed, we say here actually, even in the book, which are the levels of healthcare that they should be used on. So we have specifically the fingertip can be used at home, can be used in a health center, and then the more you go to the tabletops, then you go into specialized hospitals but they need to be all around in the ICUs, NICUs, general, medical, and outpatient areas, etc. All the whole list is here. The parameters, normally it's only pulse rate and SpO2, but you have other additional parameters for some of them. They all request probes, they all request batteries and charging cables, which have to be there. What is very important is if they can have a battery that can last more hours, if they have built-in alarms or other parameters which might be very useful. We also have some that drawbacks. For example, the fingertips are not recommended for use in neonates or very small children, can be sensitive to wear and tear, can be sensitive to temperature, can get lost. For the portable handheld, it is difficult to maintain, especially in remote areas. And for the tabletop, of course, they are less portable, but in reality, the reusable probes can be sensitive to wear and tear too, and everything will have to have their own catalog. Right now, they are both in UNICEF catalog, but also in the WHO catalog, and I will show you a screen on that. They have all the sensor, the book has the different sensor probe cable types. And of course, we suggest some of them as best options. We do have the technical specifications. For example, the SpO2 detection range should include 70 to 100%. The resolution should be 1% or less, and the accuracy within plus minus 2% under ideal conditions. We know there are others that are much 5% or so, but that is too much to make a really good assessment of the patient. We have the standards which they should comply with. And of course, besides the quality management ones like the 13485, then we have special, the ISO 8601-2-61, particular requirements for pulse oximeter equipment besides others or medical equipment and medical electrical equipment. But this is absolutely indispensable for this. The catalog, the WHO catalog for the supply for COVID actually does include all of them. The pulse oximeter, the 3 types, along with infrared thermometer and patient monitors, and some of the patient monitors might also include SpO2. All of these, this catalog is, you can find it here on the COVID critical items in this website, and they're all available, the specifications, the catalog, and the list, and also the sources. There is another page that is very important, the website for COVID in the medical devices site. And this is a website that includes here the section on medical equipment and consumables where you can find all this information. And it is my almost last slide. It is the inventory tool for COVID-19. We've been promoting this all the times in every seminar, but we just have about 30 that have been submitted. We really need to get your data. We really need to know if there is availability of oxygen, ventilators, or pulse oximeters. So they come in a format like this. Everything is here. Please submit. There is no other way we know what are the requests and the requirements at country level. So I always use this slide to make sure that whatever is innovative and so they has to have an assessment. We have to get the regulatory approvals, and then we need to ensure that there is post-market surveillance and correct use and training for all of this equipment, especially pulse oximeters. We always need to remember that they need to be adaptable, affordable, and the patient is always at the end of our activities, especially in COVID patients. So thank you very much.
Thank you very much, Adriana. The WHO resources are so informative and valuable at this difficult time.